Hi everybody, Dr. Anjana Bana here and welcome back to my YouTube channel. I just wanted to share a little bit of what I've done to myself. Well, actually, Sheetal's done to me this week. One of the new treatment modifications that we are offering at our practice. So if you watch my videos, you are now very familiar with our beautiful device called the Endymed. So this is a radio-frequency device with 18 patents on it. So it uses multipolar, multi-generator radio frequency with, so that leads to like a safer treatment, very much reduced risk of post-inflammatory hyperpigmentation. So great for all skin tones, as well as fantastic, safe, reproducible results. I love this device. So what I had done this week was something called FSR, fractional skin resurfacing. So fractional skin resurfacing, not using a laser, but using radio frequency. You can't see it on my skin now. There's still a little bit of it, but you know, obviously I've got a bit of makeup on, so it covers it up. And it's a nice treatment to do, but my advice would be, if you go into an event, at least 10 days before the event, you have the treatment done. If not, maybe a month before. Don't leave it for the last minute, because what it is your face is completely numbed, and then this device with a little it heats up the skin using radio frequency, and it's basically like stamps. It looks like a fairy with a waffle maker. That's what I can describe it as. Little scabs that are created that flake off during the week. And what we usually do at our practice is part of the treatment is 7 days after the treatment, like 5 to 7 days after, we offer you a superficial chemical peel to get rid of most of those flakes, create some brightening. So what we're doing that's a bit new. So we've been doing the FSR, doing our hydrogel mask, and often, you know, depend on the patient, we combine it with Sculptra, we combine it with Profilo, but lately we've been doing combinations with Exosomes. So one of the previous videos I was comparing Exosomes with PRF, so that's also another thing we combine the FSR with. And what I did was, because I was getting a bit of post-inflammatory hyperpigmentation from those terrible spots you get when you're in your 40s. So some people still break out. So I was breaking out a little bit, getting a bit of post-inflammatory hyperpigmentation. So we use this depigmenting solution mixed with Exosomes, so I get an accelerated like downtime, like reduced downtime. And then I also use something called SCA, and people would see it and, you know, it's not actually a gimmick, it's snail gel. So we'd use something called Endocare as well. So I put a whole lot of stuff on my skin, so I'd be ready for these YouTube videos. Even though I've still got scabs, you can't see them. So this is one of the bags. This one's actually for anti-aging, but it has something called SCA in it. Snail mucin, which is fantastic for wound repair. They use it on patients that had issues with radioactive exposure, as well as something called an extremozyme. So Endocare, it's called Edofense. There's an ingredient in here called Edofense. So Edofense is derived from something called an extremozyme, and then extremozyme is derived from a plant from Antarctica. So it stands up to extreme conditions, and it's there to regenerate your skin. There's another extremozyme called the Rose of Jericho. It was very popular in South Africa last year. If you like plants, I'm a plant enthusiast. It's this plant that basically almost looks like it's dead. It's a plant of resurrection. Some water, and then it's completely resurrected. So that is also an extremozyme. And we have something special here in South Africa called spekboom. I don't know if I'm saying that correctly. Spekboom. It's also edible. It's all over. You just break a little piece and grow it. It survives with very almost like little to no water. So there's so many new things that are happening in skincare, and that the aim is, besides, you know, like there's a move, I wouldn't say there's a move away from fillers and botulinum toxin. Those things are still popular, but skin is definitely in. And regenerative therapies using extremozymes, using snail mucin, using these Exosomes, Mesotherapy solutions, and radio-frequency. So the look is now subtle and natural. If you guys have any questions, because I've talked about a lot of stuff here, if you have any questions about what I'm speaking about, please drop them in the comments down below. Like, share, and subscribe. Bye. And also, do I look like I've had something? Do I look tighter? Well, let me know in the comments down below. Bye.